What about the public option part of the bill? Do you support or oppose a public option, regardless of what kind of health reform legislation is eventually passed?
Well, my favor bill has no public option in it, but it is possible to construct a public option that would work and would be broadly acceptable to Tennesseans. The way I've figured it out, there are about 18 different ways to have a public option. Probably half of them we wouldn't like, probably half of them would be okay. One of them that is talked about today that might be okay would be the cooperative thing. We've had co-ops all over Tennessee for 70 years. They've actually worked pretty well overall. They worked over most of America. You're from Nebraska, there are tons of co-ops out there.
Yeah.
But it all depends on how it's set up and whether it's really helping the people or working against the people's interest.
But we have a number of government health care programs in existence right now: Medicare, Medicaid, S-CHIPS, state has TennCare. There are a number of different government programs. A public option would add one more to that list.
Well, it would.
Many of us are opposed to adding any more government options to the healthcare system. You're not philosophically or ideologically opposed to doing that. Is that correct?
I want to do what works. I think Americans are practical people. We want results, and that's the bottom line. I don't think the government's always the best way to solve a problem, and a co-op properly done is just a nonprofit organization owned by the people. And that's kind of like American government, of the people, by the people, for the people.
But if it is sponsored by and the original funding comes from the government and there's some responsibility to the government because of that, couldn't it easily morph into just yet another government program?
Well, that hasn't happened really with our electric co-ops. They're still private nonprofits, even though their initial funding and continued funding did come from the federal government.